the most important part of seizure disorder, and that is GTCS. Okay, but before discussing various aspects of GTCS, always you have to keep a differential diagnosis of seizure, and that is syncope. So syncope you have to consider a very important differential diagnosis of GTCS. So we have to differentiate between what is GTCS, what is seizure, and what is syncope. Okay, most of the time we generally refer as vasovagal syncope. Okay, we usually refer syncope as a vasovagal syncope. Although you can get other two types of syncope, that is cardiogenic syncope and number 3, that is orthostatic hypotension. Okay, but the most common is vasovagal syncope. Let's see how can we differentiate syncope from seizures. Yes, I am considering vasovagal syncope. So the points will be: number 1, always there will be a precipitating factor, and usually it is an emotional one. Okay, there will be a precipitating factor for syncope, and that will be an emotional factor. Okay, number 2, there will be premonitory symptoms. Like a patient can feel complaints of nausea. Number 2, sweating. He can be thirsty. 4, tunneling of vision, etc. So number 1, there will be a precipitating factor, and most commonly it usually is an emotional one. Number 2, there will be many premonitory symptoms like patient can observe nausea, sweating, thirst, and tunneling of vision. Okay, he or she can appear pale. Number 3, position usually erect. Patient form erect posture, he or she will gradually comes to lie down. Okay. Number 4, the loss of consciousness will be gradual. Over seconds. Number 5, regaining consciousness rapid, usually within seconds. So number 1, there will be must a precipitating factor, and most commonly it is an emotional one. Premonitory symptoms like nausea, sweating, feeling of thirst, tunneling of vision. He or she can appear pale. Position usually erect. Loss of consciousness, it will be gradual over seconds, and regaining consciousness will also be rapid within seconds. Number 6, post-ictal period. No confusion or disorientation. If confusion or disorientation present, it usually less than 5 minutes. But in maximum cases, confusion or post-ictal disorientation is absent. Number 7, tonic-clonic movements. May be present, but usually last for less than 15 seconds. Number 8, other features like biting of tongue, bladder bowel incontinence is very rare. very yeah. So these are the points through which you can differentiate between a seizure or a syncope. Number one, precipitating factor, it usually present and that is an emotional one. Number two, premonitive symptoms like nausea, sweating, feeling of thirst, turning of vision, patient can appear pale. Number three, position is erect. Loss of consciousness will be gradual over seconds, and regaining consciousness will also be rapid within seconds. Postictal period, no postictal confusion, no postictal disorientation. If it present at all, it will be less than 5 minutes. Tonic-clonic movements may be present, last for less than 15 seconds. Biting of tongue, parable incontinence usually absent.